felt great when I came out of the operating room. I wasn't dizzy, I wasn't sick. Immediately after the surgery, I had no pain. I got home and still had no pain. I found that I was able to really get back to my old routine very quickly, and I was back at work really in 4 days showing houses.
I was in pain for a couple of years. I didn't even know I had a bunion, and I went to another doctor to have him look at it, x-ray it. He just said I had arthritis in my toe and I needed to just deal with it, and there was nothing we could really do. So I would just spend the day limping, and that's how I got around through life for a couple of years. I went into Dr. Moy regarding something else, and he looked at my toe, touched it, and you couldn't even touch my toe without it, me wrenching in pain. And he, at that point said, why don't we go x-ray it, look into this? And I said, please do, because, this is what I've been told, and I've been told that there's nothing we can do. And he said, there's no reason for you to be like this. And he came out and said, this is what you've got, and you need to probably, we can definitely help you and get you better, which, when you're in pain, that's all you want to hear is we can get you better.
Dr. Moore is an exceptional surgeon. He had me meet with other patients of his that have gone through this surgery right after their surgery so that I could talk to them and have my fears answered and my questions answered. I was very surprised when I woke up from surgery. I felt great. I felt as if I could return back to work that afternoon. I went home and I kept waiting for something to eventually hurt, and it never did. Knowing the pain that I felt before surgery and how easy and painless surgery was and how great I feel now, there's no question in my mind I'd do this all over again.
My girlfriend went to Dr. Moy, and I went in with her, and just because I knew that I had a problem with my foot, I wanted him to check it out. He, took time out to take me aside, looked at my foot and everything, no appointment, and from there it was just, I knew that I found the right doctor. After the surgery, I sat on the table and I woke up, it seemed like 10 seconds later, didn't feel a thing, and waited for a couple days for some pain to maybe kick in, and actually never felt a thing. 5 weeks after surgery, I then went and tested it out by going to the racetrack on my motorcycle, and had a great time and never even thought about my foot. And afterwards I just realized, wow, I didn't even feel my foot. It's pretty good for going about 7 hours a day.
Hi, Andrea. How you doing?
I'm good, Dr. Moy. How are you?
Good, good.
Good to see you.
So, how did it go after surgery, Andrea?
It went really well. I just went home and laid down and elevated my foot and kept ice on it when it would, when I'd get up and walk a little bit, it would swell just a little bit. And it wasn't too painful, just a little sore. Right now, when I walk, it's sore, kind of like you're pushing on a bruise.
All right, Andrea, we're going to change your dressing right now. And what you're going to about to see is that your foot's going to be a little bit swollen, and you're going to have some bruising along the top of your foot, probably by your toes, and maybe some down here by your ankle. And all that bruising is due to the gravity pulling it down there when you're walking or when you're laying down. Okay? Now we're going to just take this off very delicately. So just keep your foot still. What you'll see here is some of the betadine soaking through, which is the medication that we use to prevent infection. How you doing? Okay?
I'm doing fine.
Good. And just let me know if it gets tender at all. So after surgery, what have you been doing around the house?
I've been taking care of my family, taking care of my son, cooking, doing a little bit of cleaning. I've been
up and around
trying
a
to
lot,
pretty much resume normal activities, yeah.
Okay. You can see the betadine comes off onto the gauze here. And you see you do have some bruising over here, and a lot of patients ask me, why is there so much bruising over here? And again, the bruising is simply because of the surgery here. Causes a little bit of bleeding, and then that bleeding will just actually go through the tissue planes and settle by your toes because of the gravity being pulled. So how's your foot feeling right now?
It feels okay. It's a little achy, and that it feels good.
Well, you want to take it easy because you don't want to do too much and overdo it.
Okay.
and cause your foot to swell a little bit more than needs be.
Okay.
Okay. So what about the medication I prescribed to you? Were you taking that as directed?
Been taking that as directed, the anti-inflammatories, antibiotics, and the pain medication. When I get a little too carried away.
See, Andrew, the incision was made actually from right here to this point all the way back to about right here. And you can see that the betadine solution that we used on your foot stained your skin a little bit, but that will wear off within a matter of a week or two. And right now I'm taking off these little butterfly bandages called Steri-Strips. And again, these Steri-Strips are the one of the key things that really help us in creating a very fine post-operative scar, which you will barely be able to see within a month or two. And after a year, it's hard to tell at all that you even had surgery. So your skin is very weak right now, so I'm being very careful to take these off along with this incision, not against it, so we don't pull it apart. And you can see where the Steri-Strips were and how your skin's pink, and you really don't have that much swelling. A little bit, but considering the amount of work that we do with this type of procedure, you have very little in the way of swelling. And this is where the suture is. You can see how the suture goes in and out of goes in your foot here, and then weaves back and forth, and then comes out in this direction right here. And we're going to have these Steri-Strips on for probably 2.5 weeks. But you'll be able to get your foot wet here in about 10 days from now, which will have been a total of 14 days from the day of surgery. When did the numbness start to wear off?
It wore off by the next afternoon.
And did you have much discomfort after that?
Kind of some throbbing and little pins and needles.
And were you walking on it all that day?
Yes. As a matter of fact, I walked that night. I went up the stairs to bed and slept in my bed.
So how are you feeling now?
Really, actually, I'm bouncing back pretty quick.
Well, I'm glad to hear that, because I know you had some concerns before you decided to have surgery.
My mom had foot surgery and had a really bad experience with it. She had both feet done, and she had so much pain. She was literally off her feet for about 2 weeks, a lot of swelling. And so I really was very afraid of having the surgery done. I was also really afraid to go through with surgery for reasons of anesthetic and anesthesia, rather, and being knocked out, put to sleep, waking up feeling very sick and not feeling good.
Well, that's why I recommended you talk to some of my patients.
Pat Johnson told me she had heard from friends of hers and people that she knew that had had foot surgery before some really horrible stories about just the pain that they went through, the recovery period being very long, and not being able to walk for quite a few days, if that.
She must have said more than that.
She was walking that very night up the stairs to her bedroom, she said.
And how about after the anesthesia wore off?
She said she had absolutely no pain. She was wearing regular tennis shoes within about 2.5, 3 weeks, back into her shoes, and just absolutely incredible results.
So you got the impression that she was able to get back to a normal routine fairly quickly?
It didn't hamper her lifestyle at all, except for a couple of days, she said, of just taking it easy.
Okay, Andrew, so that's how your foot's going to be wrapped for the next several days. We're going to go ahead and change it again to keep this compressive dressing on. You'll have this on for about 2 weeks, and after that point, we'll switch it to an ace bandage that you can put off and on yourself.